Hello, my name is Pooja Talati, and today I will be discussing a little bit about my experience as a research intern at the Maternal and Child Health Division at the Institute of Women in Ethnic Studies. I am currently in my sophomore year of college, majoring in international relations and minoring in Italian. This past semester, I had the opportunity to intern with Mayshawn Tarver in the MCH team, working with them on research into the racial disparities mothers in New Orleans experience when dealing with the healthcare system during the birthing process, from prenatal to postpartum care. I was initially interested in this position because I am interested in reproductive and women's health. I plan on going to medical school after college, and this opportunity allowed me to explore some of my potential career paths from the view of the patient, specifically in the area of women's reproductive health, while also working towards the creation of a more equitable healthcare system. The MCH team is currently conducting a research study that aims to collect data on potential improvements that can be made to healthcare practices and birth outcomes in New Orleans by the maternal and child health community. Specifically, this study is centered around the fact that Black mothers and infants in Louisiana are disproportionately affected by maternal and infant mortality and morbidity when compared to the national rates. According to the Louisiana Department of Health, the maternal mortality rate for Black women in Louisiana is 4 times the national rate. And according to the March of Dimes Peristat report, in Louisiana, the preterm birth rate among Black women is 55% higher than the rate among all other women. My main task was reading and analyzing transcripts of individual and focus group interviews conducted over Zoom with mothers and healthcare providers, including midwives, prenatal, labor and delivery, and neonatal nurses, and an OBGYN. While the interview process is ongoing, I reviewed the data already collected and summarized the findings of the research project so far. Across the board, mothers who were interviewed about their healthcare experiences often discussed feeling dismissed or ignored when voicing their concerns or questions about their or their infant's health. Mentioning the severe anxiety and high stress associated with the birthing process, mothers wished healthcare providers better communicated with them, and many attributed their negative experiences to racism within the healthcare system. Overall, patients agreed that race played a role in the quality of care received, with Black mothers generally receiving lesser quality treatment than white mothers. Healthcare providers also noted differential treatment based on the race of the patient in their own workplaces, and emphasized the importance of open communication and trust in building a good relationship with the patient in order to best treat them. As one provider mentioned, privilege should not be the gateway for respectful care. Working at IWES allowed me to grow both personally and professionally. Before this internship, I had never written a research paper outside of class and was looking to develop my research writing skills in a true research context. Writing article reviews and a summary report during my time with IWES allowed me to practice those skills outside a classroom context while still receiving feedback on my work. Not only was I able to practice reading and selecting academic articles, judging the content based on relevance, time, and other criteria, but I also was able to practice summarizing these articles to present their main topics quickly and concisely. Writing the summary report about the current findings of the research study also allowed me to practice academic writing. I learned the correct format and citation method for the paper, while also practicing pulling data from long transcripts to best represent experiences common throughout all patients and/or healthcare providers' experiences within the healthcare system. Finally, interning at IWES was my introduction into the maternal and child health community in New Orleans. While many great support groups and organizations have popped up to help mothers, primarily BIPOC mothers, who are disproportionately affected by health issues, more work must be done to address and fix the racial disparities in the healthcare system. Before this internship, I recognized this inequality in the United States healthcare system, but reading the transcripts of the interviews with mothers in New Orleans who had experienced firsthand this discrimination during a time in which they should have had their healthcare providers' full support helped me to understand specifically how this unequal treatment affects individual patients. With a better understanding of these mothers' experiences, I can better help work towards creating a more equitable health system that provides treatment based on the individual rather than a general policy, and ensure that these women's voices are recognized and respected. I wanted to thank Mei Shan, my internship supervisor, and the MCH team for giving me the opportunity to work on this important project with them, and I look forward to continuing with them next semester. I also wanted to thank Dr. Claire Daniel, the Newcomb Institute, and the Donna and Richard Estevez Fund for providing the funding for me and the other interns to continue our work.